Hi, my name is Jessica Brezwyn, and today I'm going to be discussing muscular dystrophy. Muscular dystrophy is a group of genetic diseases that results in muscular degeneration and physical disability. This is overall caused by missing genetic information that prevents the body from making the proteins necessary for healthy muscles. There are 9 different types of muscular dystrophy, all of which affect different muscles and vary in age and the rate of progression. They are Becker, congenital, Duchenne's, distal, Emery-Dreifuss, facioscapulohumeral, limb-girdle, myotonic, and oculopharyngeal. According to a study done in 2007 by the CDC, Duchenne's muscular dystrophy is the most common and serious type of MD, affecting 16 out of every 100,000 males between the ages of 15 and 24. Although Duchenne's is the most common, the 8 other types of MD are still prevalent today. Myotonic affects 11 out of every 100,000 people. Limb-girdle affects 2 out of every 100,000 people. Facioscapulohumeral affects 4 out of every 100,000 people. Congenital affects 2 out of every 100,000 people. And distal, oculopharyngeal, and Emery-Dreifuss all affect less than 1 out of every 100,000 people. The etiology or causative factors of MD is a genetic mutation in the genes responsible for production of healthy muscle structure and function. Because the mutation occurs, the muscles are no longer able to function normally, which leads to muscle disability. The disorder can be sex-linked, dominant inherited, or recessive inherited. In the case that MD develops as a new event in the family, the muscular dystrophy would be a spontaneous mutation in the cells. MD is most prevalent in young boys ages 3 to 5. Because of the many different types of MD, the ages at which you will notice the symptoms will vary, but when the symptoms start to appear, there will be an overall decrease in movement. The main symptom of MD is progressive muscle weakness. Complications of this muscle weakness can affect your ability to walk, breathe, and swallow, may cause heart problems, cause scoliosis, and cause the shortening of muscles. Other symptoms include muscle pain, stumbling, waddling, having difficulty going upstairs, walking on toes, having trouble getting up from a sitting position, frequently falling, and having trouble pushing or lifting things. When being diagnosed for MD, the doctor will typically start with a physical exam, family, and medical history. Based on that, the doctor may recommend enzyme tests, electromyography, genetic testing, muscle biopsy, electrocardiograph, and lung monitoring tests. An enzyme or blood test may be done to test the levels of serum creatine kinase in your blood, which would establish damaged muscle fibers. A muscle biopsy involves removing a small piece of muscle, which can reveal abnormal muscle fibers, variation in sizes of the fibers, fat deposits in the muscles, and the absence of dystrophin. An electromyography is where an electrode needle is put into the muscles to measure electrical activity when your muscle relaxes and tightens. Genetic testing is done to establish gene mutations in a blood sample. The heart and lung tests are used to monitor function, and a CT scan is used to reveal any muscle damage inside your body. There is no cure for muscular dystrophy, but treatments can help manage the disorder and promote function. Treatment options for MD may include medications, therapy, and corrective surgery. A corticosteroid may be prescribed to help improve muscle strength and function and slow down the weakening of the muscles. A heart medication may also be prescribed if needed. Movement may improve with stretching and range of motion exercises. Braces, mobility aids, and breathing assistance may be needed depending on how far along the disease has progressed. Corrective surgery may need to be performed if scoliosis occurs, if droopy eyelids emerge, if joints become too tight, or to improve weakened shoulder muscle. The source of prevention is genetic counseling. It is advised to mothers where MD runs in the family to find out their genetic information and meet with a counselor. Women can have a gene but not show any symptoms and unknowingly pass it along to their child. One possible prevention method that has been talked about is newborn screenings that would test for neuromuscular diseases. Screenings for these diseases could save time searching for answers and give the family the ability to start treatment earlier. Muscular Dystrophy Association is working with policymakers to make these screenings possible and accessible. Muscular Dystrophy Association is also working to try and establish clinical trials to test out experimental medicines or therapies that could prevent or cure MD. Exon skipping is a trial in the Netherlands and the United Kingdom, which is focused on skipping exons causing the production of more dystrophin and limiting the severity of symptoms. Research is also being focused on whether stem cells can be turned into muscle cells and repair any damaged cells. and objectives for this disease are to improve care and services of patients with MD, improve the delay in diagnosing the disease, conduct public health research, and to inform parents and caretakers about children's development. Parents, caretakers, doctors, and healthcare professionals need to be more updated and informed about muscular dystrophy to give patients the proper care they need. Research is being done to establish how common muscular dystrophy is, how to slow muscle decline, and how MD is mentally affecting patients. The last objective is to make parents more aware of the physical development of their child. The American Pediatrics and the CDC has come out with a website where parents can take quizzes and identify red flags their child may be experiencing when they walk or do other activities.